So to your question around health equity or inequity is about, is the distribution of resources fair? And the answer to that is, of course, it's not. Is the disparity due to only clinical conditions, or is it also due to differences in your social and environmental and in other factors?
Mm-hmm.
And this is the difference the between disparity and equity. Disparity is frankly about, what is the difference in my health status? When I'm thinking about health status, and is the difference too large? When I'm thinking about health status, to a large extent, we are always thinking about clinical conditions, right?
Mm-hmm.
Uh, Equity or inequity is actually more about, what are the conditions that prevail today? I could be living in neighborhood X, you could be living in neighborhood Y. We come from, say, different socioeconomic strata, and that has a bearing, frankly, on how I gain access to the types of care I should historically have access to, but I haven't historically had access to that, right?
Mm-hmm.
So is the distribution of resources fair is more about, so when you're talking about data scientists and using data, you want to begin with your assumptions and looking at data, and the types of data and the data sets are going to be different. Your health status data is going to be looking at primarily your clinical data, could be some other data too. But when you're talking about health equity, you're going to begin hopefully by looking at not only your clinical data, but actually all your social, economic, environmental data as well.